and he is asking about what the status is of congenital heart surgery in the premature infant or the low birth weight infant. Are there gestational ages? Are there kilogram size cutoffs? And I suppose it depends on the nature of that. So Dr. Phillips, maybe Dr. Sorrell can comment as well.
Yeah, so really it depends on the underlying disease of the child. Again, is what we talked about is, and really what you're looking at for the cyanotic, or what would be called the terrible T's. And then is it a, for example, obstructive total anomalous pulmonary venous return? Are there things that you can do to not have to operate versus the risk of waiting? And I think that gets into the talk that Dr. Najim gave this morning on, surgery for complex neonates. Ultimately, we're able to operate down to very low birth weights. But the risks of doing that from lung development, neurologic development, have long-term sequelae. Having a multidisciplinary team, for example, in somebody who is a small birth weight, who's premature, who has pulmonary atresia, there are methods that we can do from a hybrid approach to doing a RVOT stent, through the Apex, which we've done, to then using the cath team to do PDA stents. But it's really coming up with that, as Dr. Najim talked about earlier, is for each patient is developing a personalized approach. But really, it's weighing the risks of doing the intervention, what is going to be the least invasive intervention, and what of all of them from a multidisciplinary approach is going to give the best long-term outcomes.
Dr. Sorrell, any comments?
Yep. So no, Alistair summarized that well. It's always a trade-off, risks and benefits, right? Pros and cons of operating early for the cardiac reasons versus the risk to other organ systems like the brain and lungs, as well as other organs. So a multidisciplinary team is really important in making those decisions about when to operate in premature babies.
Thank you. Any questions from our in-house audience? I have a question. Again, this might be for Dr. Phillips. How many heart transplant programs do we need? How many do we need in Florida? Somebody gave me that question, so you get it.
Yeah, that's a very good question, actually. I think it's the same question as we want some regionalization and development of expertise, and it's developing these treatment homes. And I think that when you look at the concept of the ACOs that were what was through Obamacare, I think that's something that is highly beneficial, is bringing levels of expertise, and it's the hub and spoke model of being able to bring patients into a tertiary and quaternary level center, get their care, and then be able to get them back to their communities for their further care. And developing these virtual platforms will be important. There has been a look, like there's been some big studies that have been done. One of them is in Great Britain. There was something called the Bristol Inquiry for congenital heart disease, and they reduced the number of congenital heart programs to increase the quality of care after having issues at the hospital. And they found some very good salient arguments to do that, and they reduced the number from I think it's 10 programs down to 6 programs, and that really improved the overall expertise. And clearly for transplantation, I think it's going to be the same. You want to have regional leaders that have the best outcomes. They're starting to do that in the adult world, and really having high-end programs that are going to be doing with high volume.
Thank you. I have another question for Dr. Peace. Are there guidelines on when a cardiac anesthesiologist should be consulted regarding moms with heart disease and pregnancy and delivery?
It's an interesting question. Oh, can you hear me?
Yes.
Okay. So no, it's a good question because, you know, unfortunately, a lot of times when you're taking care of these mommies, you're at hospitals that don't provide cardiac services. So if you don't have, if you're not doing open heart surgeries at that hospital and these moms walk in, you know, it can be very difficult to get a cardiac anesthesiologist involved. So depending on the facility of where you're taking care of this mom, I mean, optimally, yes, you know, you would choose to deliver this mom in one of the higher tertiary hospitals where you have a cardiac anesthesia anesthesiologist and other teams available. What happens in our hospitals where we don't have cardiac anesthesiologists is we usually bring the cardiologist in, and we'll actually bring the cardiologist into the operating room to provide TEE, you know, if it's one of these moms that is in failure.
And just for completeness, let me ask one question of Dr. Murray. Dr.
I was just going to add that, you know, our practice here is typically for those advanced higher risk, so WHO class 3 and 4, we typically will involve cardiac anesthesia.
I got a question for you. And then one question for Dr. Murray. I wonder, in our current era with COVID, and perhaps more of a dramatic current impact of a bug causing disease, and then also with our enhanced understanding about socioeconomic disparities and cultural inequities, which could impact parents' understanding of the medical disease and also how doctors traditionally explain things with cultural attentiveness to differences in how people understand and process information. Do you think could we improve this issue of reluctance for vaccinations?
So yeah, your question is a really important one, and it sort of gets to the crux of one of the challenges we have in the medical field, and I think that's adequate communication, quite frankly. I mean, we frequently have the information, but we need to be able to transmit that to our audience, whoever that is, in a way that is understandable to them, where they are and that they can use. And I think that is a challenge for cultural sensitivity and everything that we do. Vaccination is no exception. So from the data that I showed you, a lot of the reluctance actually stems from misunderstanding about the disease, the severity, the potential impact, the risk, and the safety of the vaccines in turn. I do worry a little bit about the coronavirus. Obviously, if you listen to the media, there are populations in our society that there's the way fringe that believes perhaps that it's not a thing, but then we have many who are not taking it seriously, and we're seeing that in spikes and lack of mask wearing appropriately and social distancing, and stay over there, by the way, and and so on. And I think when a vaccine ultimately does come out, there's going to have to be great care taken to assure the community that it is safe and it is effective. And I do worry a little bit whether we're going to be able to do that effectively. So yeah, I think we all need to work on our effectiveness in communication about vaccines and every other thing.
Thank you.